There are 7 warning signs of bowel cancer you should never ignore. Serious an introduction. Imagine a silent threat developing inside you, growing each day and potentially becoming fatal. Bowel cancer, also known as colorectal cancer, is exactly that threat. According to the National Cancer Institute, NCA, it is the third most common type of cancer and the second deadliest in Brazil, accounting for about 10% of cancer deaths. Ignoring the warning signs can be a death sentence. It is vital to know the symptoms that may indicate the presence of this insidious and deadly disease. This text reveals the 7 main symptoms you should never ignore and provides essential prevention guidelines. Your life may depend on it. Changes in bowel habits. One of the warning signs of bowel cancer is a change in bowel habits. It is important to know your normal bowel transit pattern, whether it is having bowel movements several times a day or just a few times a week. Significant and progressive changes, such as frequent diarrhea alternating with constipation, can be indicative of serious problems. About 65% of people with bowel cancer experience changes in bowel habits, so any change should be investigated. Blood in stool. Another alarming symptom is the presence of blood in the stool. The large intestine is divided into several parts, and the location of the tumor can influence the type of bleeding. Tumors on the right side of the colon can cause dark, almost black stools due to digested blood. On the left side, the bleeding tends to be more vivid and visible. Although other conditions, such as hemorrhoids, can cause blood in the stool, it is essential to see a doctor to rule out cancer. Abdominal pain. Persistent abdominal pain is another sign that should not be ignored. The pain can be the result of partial or complete intestinal obstruction by the tumor, causing intense cramps and pain during bowel movements. Even if the pain may be caused by gas or changes in diet, persistent and unexplained abdominal pain requires medical evaluation. Fatigue and tiredness. Prolonged fatigue and tiredness that do not go away with rest can be symptoms of bowel cancer. This can occur due to anemia caused by small bleedings from the tumor or by the excessive consumption of energy by cancer cells. If fatigue persists for weeks or months without an apparent cause, it is important to investigate the possibility of cancer. Abdominal bloating. Abdominal bloating or swelling can be a common symptom of bowel cancer. This can occur due to partial intestinal obstruction by the tumor, leading to the accumulation of gas and feces. Additionally, the tumor can hinder the transit of food and liquids, causing bloating and abdominal pain. These symptoms should not be neglected and require medical consultation. Unexplained weight loss. Unexplained weight loss is another warning sign. If you notice significant weight loss without changes in diet or physical activity levels, this could be an indication of bowel cancer. The tumor can alter the body's ability to absorb nutrients and calories, as well as produce substances that reduce appetite and increase energy expenditure. Feeling of incomplete evacuation. The feeling that the bowel has not been completely emptied, known as tenesmus, is a common symptom of bowel cancer. This sensation can be caused by a tumor partially or completely obstructing the intestine, giving the impression that there are still stools left, even if there is nothing more to evacuate. Changes in stool shape, such as thin, ribbon-like stools, can also indicate the presence of a tumor. Importance of prevention and screening. Prevention and screening are essential to combat bowel cancer. Most intestinal polyps, which are growths in the intestinal lining, do not turn into cancer, but some can develop into malignant tumors over 10 years. Early detection and removal of these polyps are crucial for preventing bowel cancer. Risk factors. Several risk factors increase the chance of developing bowel cancer. Age is an important factor, with the risk increasing significantly after 50. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, also increase the risk. Genetic syndromes, a family history of bowel cancer, height, and certain lifestyle habits, such as smoking and drinking alcohol, are other risk factors. Lifestyle changes. Adopting healthy lifestyle habits can significantly reduce the risk of bowel cancer. Maintaining a diet rich in fruits, vegetables, and fiber, avoiding excessive processed and red meats, practicing regular physical activity, Avoiding alcohol consumption and quitting smoking are important preventive measures. Terasuka's increase in young people. Bowel cancer is increasing in young people under the age of 50. This may be related to inadequate diets, rich in processed foods and low in fiber, as well as sedentary lifestyles and increasing obesity. Early screening also contributes to the detection of cases that were previously undiagnosed. Tips for prevention. Some important tips for preventing bowel cancer include staying well hydrated, consuming foods rich in fiber and antioxidants, such as fruits and vegetables, and including natural anti-inflammatory spices in your diet, such as turmeric and cinnamon. Dairy products, although controversial, may have a protective effect. Regular physical exercise, avoiding alcohol and smoking, and having regular checkups are essential. Regular checkups. Having regular checkups, including fecal occult blood tests and colonoscopies, is crucial for the early detection of bowel cancer. Colonoscopy is an examination that allows the visualization and removal of polyps before they become cancerous, offering a unique opportunity for prevention. Colonoscopy. Colonoscopy, although uncomfortable due to the need for complete bowel cleansing, is a safe and effective procedure. The examination, performed under sedation, allows the doctor to inspect the intestine with a camera and remove polyps or perform biopsies of suspicious tumors. The examination lasts 30 to 60 minutes, and the preparation is the most challenging part. Early detection. Early detection of bowel cancer significantly increases the chances of cure. In its early stages, colon cancer has a cure rate of 90%. Countries with effective screening programs have managed to reduce the incidence and mortality of colorectal cancer, highlighting the importance of regular screening. Awareness. Raising awareness among the population about the warning signs and the importance of screening is crucial to combat bowel cancer. Access to screening tests should be expanded to everyone, regardless of economic conditions, to ensure that more people can benefit from early detection. Conclusion. Bowel cancer is a serious disease, but early detection and adopting healthy habits can save many lives. Knowing the warning signs and having regular checkups are essential measures for effective prevention and treatment. Stay informed, take care of your intestinal health, and help spread this information so more people can protect themselves against this devastating disease. Finalization. Do not put off taking care of your health. If you or someone you know has any of the symptoms mentioned, see a doctor immediately. Prevention is always better than cure, and early detection can make all the difference in the fight against bowel cancer. Share this information and help save lives.